Hi, I am Dr. Rajasekhar M R from Chirag Global Hospitals, BTM second stage, Bangalore. With all these, you might have got more confused. So let me explain in a very general, simple terms what is IBS. See, first let us understand how the system works. Whenever we eat food, it has to go from mouth to the stomach and passes through the small intestine, large intestine, comes out. So for all these, the whole of the gastrointestinal system is made of a single tube where sometimes it becomes a stomach in some place, a distended organ, in some it becomes a narrow, and there are different digestive juices coming, acid coming somewhere. All that will make in helping digestion. So digestion is one part of it, but the bowel movement, the food has to move from mouth to the anus. So what is the mechanism for that? The whole length of the tube is made of two layers of muscles. One internally it is a circular layer of muscle and the other one is a longitudinal layer of muscle. So these two will help in moving the contents of the intestine, whatever food you have eaten, from the mouth towards the anus. So how does it happen? So circular muscle will contract and push it like this. Longitudinal muscle will be acting like this. By this mechanism, it will be pushing the food from one end to the other. So now, it should happen very rhythmically. It should happen in a particular time. In the stomach, it should stay for 3 to 4 hours. A small intestine, different length of time. Large intestine, different length of time. So, for all these muscles to act, there is a network of neural network. So, thin neural network is there throughout the intestine and stomach, and they will be regulating the movement. Apart from that, there are certain hormones, local chemicals, neurotransmitters, which are there in the intestines, which will again regulate the bowel movement. And apart from that, the food what we take, the quantity of food and the quality of food also decide the bowel movement. And more than that, the mind. When you are stressed, when you are in anxiety, you will have more bowel movements. When you are calm and this one, it will reduce. So the mind also has got effect through chemicals released. So many things will be affecting on the movement of the bowel. So bowel movements, whatever we are talking of IBS is nothing but the bowel movement disorders. Irritable Bowel Syndrome, IBS is Irritable Bowel Syndrome. Bowel is getting irritated. Either it will overact or it will underact. So if it overacts, it causes loose motions. So the moment you eat food, you feel like running. You have eaten a small quantity, again you have to go for. So number of bowel movements will increase if the bowel is irritated in very actively. On the other hand, if the bowel movement is slowed down, then they will get what is called IBS-C type, constipatory type. If it is fast, it will be IBS-D. If it is slow, it will be IBS-C. For sometimes it will be constipation, sometimes it will be diarrheal type. So more confused one. Why bloating happens? So the bowel movement should be like this. It has to start from one end and it will be pushing and going like this. Supposing here also it is contracted and here also it is contracted. The contents inside, the gas, fluid, all that, it gets bloated there. So that's why the bowel movement rhythm is not proper, or if it is not going in a particular fashion, it will cause all that gas which is there. It should have got expelled. It is staying there only. It will be coming back, going back and staying there and causing all that changes. So it is a bowel movement disorder. It's not simply digestive disorder. So whenever there is problem with the digestion, also it can affect the bowel movement. And when the bowel movement is too much, again it will affect the digestion because absorption will not be there. If whatever you are eating, it is going off in toilet very, very fast. So they will not be able to put on weight. Their absorption, they will get diseases of the malnutrition also. This is a very complex issue and it is known as a psychosomatic disorder. Whenever we are treating IBS, it is not that we give some tips and you follow that, it will be all right. So we have to manage the mind, we have to manage the food, we have to manage the physical activities, and we have to manage the bowel contents. The bacteria inside our intestines, which are helpful bacteria, they take a lot of very great role in managing the bowel movement. So all these are to be studied, which is affecting which person, which is more affecting which person, we have to decide, and then we'll manipulate accordingly, train them, and then it is a long-term disease that we give some tablets, it is gone, not that way. So we have to understand the whole process and treat. That's why IBS has to be taken seriously, and we have to work out with the patient on a long-term basis, train them, and then they have to manage the whole lifestyle forever. This is how it has to be treated.